and girls are being left to suffer in silence because their gynecological conditions are being dismissed due to medical misogyny. That's according to a parliamentary report which has been released. It found conditions such as endometriosis and adenomyosis are treated with inadequate care due to what they call a pervasive stigma and a lack of education by healthcare professionals. So do you think it would make a difference if female patients were seen by female doctors, Sue?
Oh, yeah, I think it very much depends on the situation. I think, personally, I mean, I know for myself with my gynae issues, I was recommended somebody to go and see, and I had the privilege of being able to do that. If you are not in that circumstances and you are going to your GP with an issue and they are going to refer you and you have no idea who you're going to go to, then personally I think I probably would go to a woman who I would just naturally assume that she's going to have more understanding of what I'm going through.
And has that happened before in the past when you've asked for help?
As I said, I have been very fortunate, you know, that I have somebody who I specifically was advised to me and I was able to go and see that person. So, no, but I do know people it has happened to do. I do feel now, I mean, it really worries me, the fact that, you know, the services or the lack of services is available now because there is so little time that we have. We are still effectively looking at, you know, at a system that's been run by men for men historically, which adds another layer. And, you know, we were talking before about it, years ago, even slightly before my time, although I'm 61, you know, I remember when I had access to books like, there was a fabulous feminist book called Our Bodies, Ourselves, which was just a wealth of information that wasn't really available from my GP.
But isn't the problem now? I mean, I do think the NHS has got a lot of female executives higher up the system, but if you're talking actually at the coalface of your local GP surgery, most people will be grateful for an appointment with anyone, no matter what sex, male or female. I mean, my partner spent 45 minutes this morning and was 18th in the queue at 8 o'clock this morning, coughing all the time, trying to get an appointment, and that is pretty typical. And two of my closest female friends have waited literally months and months and months for referrals to specialists for fibroids and heavy periods. And these are women who are trying to work and earn a living at the same time as conditions that make it almost impossible for them to do so. And one of them was bleeding so badly, she was out and no shops were open, and she went into an emergency department of the hospital and asked for some pads, and they said, we don't hand them out. Now, with that attitude, it's terrible.
Yeah, and I think we've been conditioned as women to accept certain things where our health are concerned. So when you have a heavy period, and if you have been to see a doctor, and that can be male or female, from experience and from friends' experiences, it's, well, that's just part of, you know, the reproductive system. Some months you have a heavy period, some months you don't. So we've normalised the idea that your period is so heavy you bleed through, that we're supposed to accept that that is normal. When it's not normal, it's the opposite of normal. What
also worries me about that, I mean, and I went several years ago, had the exact situation. I just put up with really heavy periods because I just thought that's what you do. You just put up with it until I found out, of course, it was fibroids. And there was something wrong. But what worries me, although I am thrilled that we now see adverts sort of, you know, for sanitary wear that we need. What concerns me, there is that there are adverts out there that sort of discuss and say, like, oh, buy this for your heavy flow. And it worries me about whether people just think, oh, that's just normal, that's what you have, you know, it's
normal, because I always suffered with that, but it was like, oh, it's nature. It's just the way it's meant to be. So I didn't question it. I maybe would have questioned it if later on in life, when it might have been too late, if all of a sudden I couldn't have children. And then I'd have been angry if they'd have gone, well, actually, it wasn't nature, it was a problem. My daughter, Kira, had problems from very, very, very young, you know, girl problems, and they were constant. And there was one time when she went again and she got back in the car and just sobbed. because she went, they've literally just said, oh, go on the pill again or take this pill. And she went, I don't want to. I want them to sort it out. But actually, it was sorted out in one way because she had this terrible pain in her side and I thought, oh, her appendix are going to burst, blah, blah, blah. So we sent her to A&E. And it was actually a woman gynaecologist who kept her in for like a week to sort it out because it was actually a cyst that had burst. Whereas other people were saying, oh, it's just a grumbling appendix or it's because your periods are heavy, and actually it was a cyst that had burst. But it was a female gynaecologist that sorted that out. She eventually sorted herself out, but because she changed her diet.
I think it's well documented that the waiting list to have fibroids dealt with is one of the most common issues that women face, and it's got one of the longest waiting lists.
And you've also got a situation where women are going to GPs and sort of saying, I'm in so much pain, I cannot work, I cannot get out of bed, I cannot deal with this. And rather than sort of looking into it, it's almost like it's disbelief. Well, I'm sure it's not as bad as you're saying it is. It's the assumption that women are lying. Because when we look at the research into reproductive health, less than 2.5% of publicly funded research is dedicated solely to reproductive health. Let's compare that. 5 times more research is put into erectile dysfunction, which affects 19% of men, rather than into premenstrual syndrome, which affects 90% of women.
That's shocking.
This is the situation that we're dealing with as women when it comes to being able to deal with our health. They're not even looking into why we have the issues that we have. So I think when it comes to discussing whether it should be male or female, we should be looking into the system itself, which is completely stacked against women from almost every single angle. A poll online on Twitter, actually. Would you feel more comfortable being treated by a female doctor? Yes, said 78%. No, said 22%. So thank you to everybody that's got involved in that. But I actually want to stay on the subject of health.